Good day, respiratory family. We're going to talk a little bit about respiratory therapy as a career, as a profession. And working in the field, I come to the realization that not many people know about respiratory therapy, what it entails, what it is. And it's, working in the healthcare industry, working with people with cardiopulmonary respiratory issues. A lot of times the heart and the lungs and many other organs work in a play together, but what I've seen mostly in the field has been the heart and the lungs working together, or working against each other. Not against each other, but sometimes when the heart has issues, it subsequently affects the lungs. So me personally, I chose respiratory therapy because I was in patient care for a long time. I was in behavioral health, taking care of the patients that I had, mental behaviors, schizophrenia, bipolar, anxiety, depression, things of that sort, all kind of like, patients with behavior issues. And I've done that for up to 8 years, probably even longer than that. And then I came to the realization that I really like patient care. And this is something that I wanted to get into career-wise, moving forward. So working in behavioral health, I got into the program, and the teachers and stuff was, it was a difficult program. It was difficult. One of the most difficult things I've been through, far as mentally preparing myself, studying, taking myself away from external factors and really focusing on what I was supposed to be doing. So once I got into the program, the program, like I said, was pretty good. It was introducing me to. Let me back up a little bit. So I initially thought I wanted to do radiology, and ultimately, I understood. I knew that this was not a field that I didn't want to do. I really wanted to be a little bit more hands-on with patient care, and so going through the respiratory program, we got to experience many different forms of equipment that I've never seen before. I'm not a person that's been to the hospital a lot of times prior to studying the field of respiratory. So I seen some of the equipment when I was at the hospital, but I wasn't really knowledgeable of them. So going through the program, we were just introduced to different kinds of equipment, the bubblers, like oxygen delivery devices, bubblers, simple masks, nasal cannulas, all the way up to BiPAPs, CPAPs, other forms of therapy that aided in people's rehabilitation with respiratory issues. And as the time progressed, I became more and more intrigued because it was something that I knew nothing about, and I love learning new things. I love tackling new challenges, and it was a challenge for me that it tested my will, my mindset, and my power to endure the grueling coursework. I found a group of friends, and we would study together. We would spend late nights on the phone studying together, early mornings studying together, and it was just really cool to have that camaraderie. And then once I passed the class, it was time for the boards, and we had 3 tests to take. We had the CRT, the RRT written, as well as the RRT. It's like simulations where you will be going through patient simulations just to find the best course of treatment for that particular patient. And the tests were, especially the simulation was pretty difficult. Some people passed it on the first try, some people passed it on the second try. And once I got that RRT certification, I was like, it made me so happy, so filled with joy and admiration and just positivity, because it was something that I put in my mind that I really wanted to do, and I executed it. I put my mind to it, and I really went full-fledged in making sure that I did what I was supposed to do in order to pass this class. And once I passed the class and passed the boards, it was time to start work. And at that point in time, it was like 2013, 2014, it was difficult for me to find a job. Like, nobody wanted to hire a new graduate. Times are different right now because there's a high demand for respiratory therapy, and especially what's going on with the virus, the coronavirus. There's a greater need for respiratory therapists. This is we are the first line of contact when it comes to not the first line. Nurses are first, but we work real intimately with patients with respiratory issues, pneumonia, viruses, rhinovirus, coronavirus, influenza. So we it's a larger need for it now. But when I got into school, I actually had to work my way through the ranks. So I started working at a nursing home, and the nursing home taught me a lot, because it was long-term patient care. So the patients was basically there for a long time. Some of them was living there. Some folks was there for rehab, and it really gave me a sense of what the nursing home life was like with respiratory. And then I went on to an LTAC, where the patient stay was a little bit, it wasn't as long as the nursing home stay. We probably stay between 2 and 3 months, but we were able to deal with a lot of tracheostomy patients and and rehabilitation. The patient that was intubated and was on the ventilator for longer than 2 weeks, and sometimes when the patient is intubated for a longer period, up to I guess between 10 and 14 days, they risk the infection of ventilator associated pneumonia. And so they wind up end up with a tracheostomy tube, and that's why they would come to the LTAC, because they had to be weaned off of the ventilator and then weaned off of the tracheostomy tube, meaning that they had an artificial airway in place, that they had to learn how to function without the ventilator first, and then function just on regular oxygen, and then wind up getting the tracheostomy tube taken out if they were an ideal candidate. And then now I'm in a hospital, so I worked my way through the ranks, and I've understood and been able to see different kinds of patient care and therapies, and I'm grateful that I was able to work my way to the bottom into where I am now, because it makes my arsenal and my tool belt far as me being a respiratory therapist, make me a little bit more marketable. Years of experience, and now I'm on a travel therapy. So I've just been working my way through the respiratory field, and honestly, I can't think of anything else better that I would rather be doing in the field of healthcare than respiratory therapy, because it just answers my call, and it answers my want for patient care. It answers my my want to be involved in a healthcare team and integral to the patient's rehabilitation. So it has been great for me. But I chose respiratory because I was heavily in the patient care prior to going into respiratory therapy, and then I just wanted to continue my career field in that kind of field. But there are things like you have to be willing and an advocate for patients. Patients are there for rehabilitation. They need to be there with somebody that's going to show genuine love and compassion and care for their disease type or their pathology, and helping them with rehabilitation. I mean, I don't think it's for people who don't care about patient care and just in it for the money. I mean, it is good money, but I think that ultimately, you won't survive in this field if you aren't really for the patient, and you aren't in it for the rehabilitation of that patient. So I think that's something to look at when you're choosing your career field. Would it fit you? Could you see yourself doing this for a long period of time? And I could. Also, I mean, you have to choose whether you want to be in a nursing, respiratory, radiology, pharmacology, a physician, which requires more schooling. But I think I landed in the good career field, and now I'm looking to continue my knowledge base and my learning, and working on being a good respiratory therapist. So like I said, when you're choosing your medical field, I mean, it's between you want to deal with patients that you have to deal with blood and feces and urine and stuff like that, and that kind of patient care, or you want to be on the respiratory side where you're likely to see some blood, some more so sputum related to the care of the patient. So it's just things to decide when you're getting into a career field like respiratory therapy. What do you have to offer the field? Are you compassionate? Are you loving? Are you genuine? Are you caring? And I mean, this is important when you're getting into the respiratory therapy. So that's why I chose respiratory therapy. So this is just something give a quick understanding of what respiratory therapy is, and what it offers, and maybe it may be a career field for you.